We're here at the Tampa Bay Institute for Music Therapy in Temple Terrace, Florida, with Sharon Graham, the founder and director. She is going to explain how the power of music can be used to treat people with traumatic brain injuries, developmental disabilities, and much more. Thanks for having us, Sharon. Why don't you tell us a little bit about your background and how you became affiliated with music therapy?
Sure. I began as an elementary music teacher, actually, and I was working downtown Tampa, and I found that the children had some additional needs that I knew I was not trained to meet.
Recent research has shown that the effects of growing up in poverty can cause high levels of stress, which can affect the way our brains develop, inhibiting our ability to learn.
I also knew that music could be an effective tool if used properly, but I knew I was not trained to do that adequately. And so I went back to grad school and found out that music therapy is indeed a profession and that is the perfect fit for what I was wanting to accomplish with the kids.
For older adults and people with neurodegenerative diseases, music therapy can be an effective tool in momentarily regaining their speech.
And a really effective way to communicate together. A lot of times the older adults are not able to say everything, express everything that they would like to say, but while engaging in a song, singing a song with their loved one, they're able to say all of the things that they would like. I love you, you are my sunshine, etc.
This can help decrease anxiety and disorientation. A lot of times they don't have any short-term memory, but the long-term memories.
Yes.
When you play songs that they heard when they were growing up, or they were in their 20s, it all kind of comes flooding back, and they know the words again and things like that. It's very interesting how that's accessed.
Music is such an integral part of our lives. For example, if you get good news driving in the car and you're listening to music, those memories become embedded.
Every time you hear that song, your brain will recall those memories and activate positive neurotransmitters, changing your physiology. Tell us about the work that they use with music therapy on premature infants. That's very interesting to me.
This is great,
Yeah.
yes.
Yes. So one of the things that we're looking to do is partner with hospitals in the Bay Area, because we have found, and the research has shown, 2 major meta-analyses have shown that NICU music therapy effectively decreases infants' length of stay by an average of 5 days.
And what is NICU, just for those that don't know?
The neonatal intensive care unit, so
Gotcha.
premature infants.
Music therapy is used in the NICU to mask loud environmental stimuli, such as noisy machines. They can even sync music tones with the beeps of heart rate monitors, turning a monotonous droning sound into a calming auditory experience. And what does it trigger with the babies?
The calming nature of the active music listening that we do as the very first intervention within the NICU. It not only masks, but it decreases their anxiety. We're able to help them get to sleep, and that is crucial because it's when their brains develop.
And tell us about this pacifier.
Yes,
Yeah.
I would love to. This is really a genius idea. Dr. Jane Stanley developed this. It's called the PAL device.
The PAL, or Pacifier Activated Lullaby, is a device equipped with a sensor inside, which is connected to speakers. When the infant sucks on the pacifier, it activates a pre-recorded lullaby.
Well, I have a thing to tell you and it won't take
It teaches the infants how to feed, and that has been the biggest barrier for them. Again, in the stressful environment, they're burning calories at a higher rate than they would be otherwise. And when they're born early and they don't know how to feed, that becomes a problem.
Okay, so it works on children. We've covered the fact that it works for like dementia and Alzheimer's,
Yes.
but what other ailments does it treat?
Well, music is a fantastic tool because it's processed all throughout the brain simultaneously. And because of that, we can use it to effectively rewire around any areas of the brain that have been damaged.
Which is called neuroplasticity, right?
Exactly.
Another topic that we've covered on the
Yes.
show, so it's interesting to see it tied in to music therapy. So if there's a damaged part of the brain, someone that has traumatic brain injury, you're saying they can basically rewire their brain through the therapy?
Absolutely.
Okay.
Absolutely.
And how does that work?
So, for example, if someone has a brain injury affecting Broca's area, which is one of the speech centers on the left side of the brain, singing and song lyrics are stored, those skills and resources are stored in different areas of the brain. So they're accessible even when expressive speech is not.
That's like someone I've read about people that would have a stutter, or even people with Tourette's that had a real hard time speaking. You get them to sing and they could sing like an angel without missing a beat.
Exactly.
Sergeant Billy Goodzak is a former Army combat medic who served 2 deployments to Iraq. Billy suffered a traumatic brain injury that affected his fine motor and speech skills.
Typically, it's been said that really not many improvements can be made this far post-injury. However, as we've discussed, music is processed throughout the brain simultaneously, so we've really had some tremendous results working with him.
1, 2, 1.
It's difficult for Billy to communicate, although when the music therapy begins, he's able to engage the other areas of the brain, which allows him to speak clearly. In conjunction with physical, occupational, and art therapies, music therapy has been instrumental in regaining his movement.
During music therapy sessions, I think it was we were the first to notice, and we had been working on this really consistently, for him to be able to engage certain muscles to move and play the drum. And so we were able to show the OT one day that he was playing the drum on purpose with our giving a verbal prompt and also a tactile cue on the muscles that he needed to use in order to make that movement. Wow. The OT was beside herself. She couldn't believe it.
Billy is then able to apply these skills outside of therapy for tasks such as feeding himself.
How does it work for someone that might be suffering, say, with post-traumatic stress disorder, or even someone that was involved in domestic violence?
We are able to use the music to help emotional regulation and to increase emotional expression, and also as a processing tool to address the trauma that people have experienced, be it domestic violence, human trafficking, or the invisible wounds of war.
Yeah. I know just in general, Ethan, for me, I know if I'm having a bad day and all I have to do is turn on a song that I love, and all of a sudden you're just kind of in a happy mood. After Billy's therapy, we sat in on a children's group music session. Are there certain certifications that are needed, or how can a facility become accredited?
To provide music therapy, I'll give you a little bit of a background. We have a degree in music therapy, and there are 75 degree programs across the United States that offer degrees in music therapy. There are 3 in Florida. After that, you have the credential MT-BC, which stands for Music Therapist Board Certified.
While in some cases pre-recorded music might help, typically the live music is found to be the most beneficial.
We are learning to be proficient with voice, guitar, and keyboard. So the music therapist, in most cases, is going to be providing live music within a music therapy session. We're going to be engaging the patient or client in active music making. That's what it's all about, engaging them to increase any behavioral or physiological changes.
Sharon finds the most joy in moments when she is able to use her clinical counseling skills to engage patients in therapy to reinstill hope.
Maybe we zoom out and look at the broader picture and talk about the course of their recovery and show them how far they've come, asking them, their thoughts about that. How do you feel looking at all you've accomplished thus far? Do you think you can go even further? And each time we do that, we're able to reinstill hope and get a rush of improvement again.
Now, if somebody wants more information on music therapy and this institute in particular, how would they do so?
Absolutely. Well, my website is www.musictherapyfl, as in the state abbreviation, .com. And nationwide, we have a database. Please go to www.cbmt.org. That's the Certification Board for Music Therapists, and you can find a board-certified music therapist there.
By harnessing the power of music, facilities like Tampa Bay Institute for Music Therapy are literally rewiring damaged brains and providing hope for patients suffering around the world.
Thank you so much for all the work you do here.
Thank you
Thanks,
very
Sharon.
much.
Absolutely.